Hello everyone, I'm Dr. Mukta Kapila. I'm a director in Obstetrics and Gynaecology in Fortis, Gurgaon.
I'm Dr. Swati Mittal. I'm a senior consultant in obstetrics and gynecology in the same hospital.
We both are from top medical schools in India. I am from Armed Forces Medical College, Pune.
And I've been to Lady Hardinge Medical College and Maulana Azad Medical College, New Delhi.
And we work as a team. We are laparoscopic surgeons with more than 20 years of experience in this field, operating upon national and international patients, which has given us a lot of experience in this field. And also, Fortis provides us with the best of equipment and great working conditions, and it is very enjoyable to work here. Today, we are going to discuss hysterectomy. Hysterectomy is the removal of the uterus from inside the body. It is the most prevalent surgery in gynecology. Dr. Swati, please talk about what are the reasons and indications for doing hysterectomy.
I'll be discussing the common conditions. So the most common is like increased bleeding during periods, which happens in fibroid. The bleeding may be irregular, it may be heavy with clots, it may be associated with extremely painful periods, or other associated conditions like adenomyosis, endometriosis, other pelvic masses. Even early stages of uterine and the cervical cancer, they may need hysterectomy.
Yes.
And we can add more numbers to the list.
Yes. And there are various kinds of hysterectomies. We do total hysterectomy in which we remove the uterus and the cervix. Then there is subtotal hysterectomy in which we remove the uterus but the cervix is preserved. And then there is total hysterectomy with bilateral removal of ovaries, that is removal of both the ovaries.
Though we take all the precautions if the ovaries can be preserved, because the ovary release hormones, which is very good for the women health. In fact, it is required for well-being, for the bone health,
yes,
and cardiac health of the women.
Yes. And Dr. Swati, can you talk about what is the approach to do hysterectomy?
Yes. Hysterectomy is the most common people know is abdominal hysterectomy, where we cut open the abdomen and take out the uterus. Then vaginal hysterectomy, laparoscopic hysterectomy, and robotic hysterectomy.
Yes, and here I think we will concentrate more on total laparoscopic hysterectomy.
Yes.
Right. Laparoscopy involves 3 T's. First is technique, second is teamwork, and third is toil. Technique we have developed over various years, which involves very minimal blood loss and decreased operative time, and the patient is discharged after 24 hours, within 24 hours, and maximally if patient wants to stay, can stay for 48 hours. And teamwork, 2 minds and 2 pairs of working hands are better than 1.
Yes.
We complement each other, we help each other for the best output of the patient. And third, of course, is toil. We have worked very hard to master this technique. It's over years and years that we have mastered this technique so that the patient gets the best output.
Yes.
Right? And
the real challenge comes.
The real challenge comes when we have to operate upon large uterus. Previous surgeries having been done on the patient, or the patient is overweight, then our coordination that time really matters.
With complicated cases, it really does matter.
But we do manage everything here.
Yes.
Dr. Swati, let's talk about the pre-operative workup, the operative techniques, and post-operative follow-up of the patient.
Yes. We call the patient 1 or 2 days prior to the surgery. This is basically to make the patient fit for anesthesia. This is called PAC, pre-anesthetic checkup, which involves blood work, in which hemoglobin is very important, and other parameters like X-ray, ECG, echocardiography if needed, that everything is done. The patient is admitted on the day of the surgery itself, 4-5 hours before the surgery. But the patient should be fasting overnight, and the last meal which the patient has eaten, it should be light. And as far as the procedure goes, the surgery is done under general anesthesia.
Yes.
This is a minimally access surgery where we make few very small holes, which varies from 5 millimeter to maximum 1 centimeter.
The real joy of laparoscopic surgery is when you go to visit the patient the next day. The patient is smiling and moving about and ready to go back home. And you must be wondering how we can discharge the patient within 24 hours. This is with the technique that we use. The blood loss is minimal, and Fortis does provide us with top class equipment and makes us very, very comfortable. Thank you.
Thank you.